Hi everybody, my name is Liz Mason. I'm a division manager with the behavioral health branch with HHSA. I'm also a licensed therapist by trade, and I'm here to talk with you today about some of the incredible things happening in the city of Tulare. You may already know that there is a Hillman campus in Tulare that already serves our community. Right now, Public Health operates several really supportive programs for the folks that are living there. Things like WIC, Children's Services, nursing that goes out into the streets, and many other things. But what I'd like to also highlight is that behavioral health has a project in the hopper that's going to add to that campus and add to the resources available to people in the area of Tulare City. So what we are going to be building is a behavioral health urgent care clinic. This will be the first of its kind here in our county. The behavioral health urgent care in Tulare will be designed to primarily help adults that are living in our county. But if a family were to come in or someone brings their children along and they're looking for help, we can help point them in the right direction. And we want to make sure everybody's needs are met in some way. And there's no wrong door when it comes to seeking out help and getting the care that you need. Normally, a person might call us and ask for an appointment and have to wait for a few days, maybe sometimes a few weeks, to get connected to the person that they need. And this is going to help solve a bit of that problem. People can drop by, they can share what they're experiencing with some of the staff that will be on site there, and get immediately connected to support and linkage to a wide array of services. Now, one thing I'd like to share is that we are very proud of our peer support specialist program. But something that has happened in the last few years is our system of care and our treatment teams have changed to include people with lived experience. And so what that means is folks who have maybe gone through a recovery process of their own about mental health issues or addiction issues, or maybe have come off the streets and get into housing, they're able to share their stories and their lives with others. And they go through training and an actual certification process and are able to really connect with members of our community that maybe myself as a clinician, for example, might not immediately have a connection with. And really, they are the backbone of our system now, and we're going to have plenty of those peer support available on site, again, to be the first face to warmly greet people who are coming through the doors. While we're working on our project, we're hoping that it will open in late 2026 or 2027, but we want you to know about it now to help build the excitement and the anticipation, because we're going to have some really great things happening. But I also wanted to take time to talk about another project that's happening in the Hillman area in Tulare City. You may have heard this or maybe not, but the city of Tulare is actually working on opening their very first permanent shelter. That shelter is scheduled to open doors hopefully in the spring of 2026. And while that project isn't an HHSA specific project, we are very much involved and partners with the city in trying to help that community, especially our neighbors who are unhoused. And so as that shelter is being prepared, there is also a safe encampment site in the city of Tulare near the Hillman area where people are living currently in tents. And behavioral health has a presence there. We have a field-based services program that's operated by our partners Kingsview, who go out and meet with people where they are on the side of the road or at their tent to offer therapy, to see if they need to see a doctor, to get them connected to a peer support specialist and help bridge the gap and get them connected to the services they need. So the great thing is once our urgent care does open its doors, it's going to be right there in that same area next to the shelter, next to the programs run by Public Health and many other community-based organizations. And so within walking distance, we're going to have a full array of support services that people can access easily and almost immediately to get the help that they're looking for. If you'd like to know more about this project or any of the other things we have going on, check out our website,